Okay, so you always want to make sure that the arm is supported. You want to have a hand underneath the elbow as often as you can at all times. Makes the shoulder feel a little more comfortable, helps them relax. The starting position, you want the elbow to be a little bit higher than the rib cage because that'll help open up the joint space, prevent pinching. And then the arm is about 45 degrees off the body. Again, that'll help open up the joint space and prevent pinching. The first motion we'll stretch into is external rotation. So you're not going to pull the patient's arm because that's going to cause a lot of pain and resistance. You merely hold under the arm, like under the elbow, and then allow their arm to fall outwards. If you've had a type 2 rotator cuff repair, meaning that your subscapularis was repaired, you are only going to go from straight up and down to 30 degrees outward in this position. If you have not had a subscap repair, you're able to go to your patient's comfort level all the way to 90. And again, you're not pulling, you're just letting the arm fall. To do internal rotation, you get a firm grasp on the wrist, swap hands, and again, you're underneath the elbow. This one, you're just letting the arm again fall towards the stomach. I usually aim towards the belly button, so you're just letting their hand fall towards the belly button. Okay, what you're looking for on this one, you don't want to see the shoulder pop up because that means it's the shoulder blade moving and not actually the shoulder stretching. So make sure the shoulder blade stays nice and low and you just let it fall. Okay, same thing, you're going to firm grasp, swap hands, and underneath the arm. The next motion is overhead. You're going to gently pull up at the wrist just to kind of help the arm relax. That way you're not pulling this way. So you'll create a gentle upward pull and a gentle upward lift. And you're going to go more into a Y position. Rather than having the arms straight in, you're going to be more like a YMCA and just gently let the arm fall. Again, you're not pushing to gain range. You're just letting the arm fall to the patient's comfort level. You come back out of it, support underneath, and relax. The last motion we're going to do is abduction. You can think of it like a snow angel. So you can do this a couple different ways. You can cradle the arm and kind of sweep out to the side. Back and forth, you can sweep all the way up and around. If you're not comfortable or not able to kind of rock around like that due to a wall or whatever reason, you can use that same hand position here and you just support the elbow and the wrist as you slide around. And again, none of these are to force or gain motion. You're just maintaining what you have. And if your tissues are loosened up and you're able to stretch a little further, go ahead and do it. But don't stretch past the point of pain.